Addiction, if not treated, can lead to long-term damage and death. Mount Regis is dedicated to getting people the help that they need in order to treat the addict before it's too late. I talked with the Director of Nursing, Jamie Pruitt, about a common addiction, alcoholism.
Some of the risk factors of alcoholism is if you have parents that are alcoholics, if you have mental health issues, if you have a low self-esteem, if you have high levels of stress, which sometimes we all have that, family or cultural beliefs. So there's many things that can be risk factors or that can contribute to alcoholism.
And what qualifies as alcoholism?
Alcoholism is actually an addiction, which our body becomes dependent on this substance, or which is a drug. Alcohol is a drug.
And what people don't realize is that not only are you going to eventually have to fight the addiction, but it can have long-term effects as well.
Correct. There's many long-term effects that alcoholism can cause or that can contribute to. One would be cardiovascular disease, so hypertension, which is high blood pressure. It can lead into a stroke or a heart attack. You can have liver disease, which can turn into cirrhosis of the liver, which is end stages, which can contribute to one's mortality. Anemia, you can have bleeding in the GI tract, pancreatitis, depression, nerve damage, changes in one's mental status, end-stage dementia, and eventually all of these can cause one's mortality.
And so what people don't realize is that an addiction doesn't just affect you while you're battling the addiction. It can affect you in years to come.
Correct. Many of the things with alcoholism, like for example, in 2010, there were 88,000 deaths alone in the United States due to alcoholism. This does not even account for the car accidents or the vehicular accidents. In 2014, 6.7 per 100,000 people died from alcoholism, which either was alcoholism that's contributed to another medical condition or something tragic.
So if you are, finding yourself becoming addicted to alcohol, what can you do to kind of stop that? I mean, seek help for sure.
For sure. There's many ways that someone can get support for alcoholism. Counseling, which can address some emotional problems. Inpatient therapy, which will address coping skills and behavior, as well as detox, so that we can give certain medications that can detox you off of the alcohol, which normally is about a 5 to 7 day process. Some have it harder than others. There's many group therapies, there's support programs, there's 12-step program, as well as intensive one-on-one counseling. There's many medications that we also can give to control cravings for alcoholism once a patient's discharged from an inpatient setting or outpatient therapy.
And what I love about Mount Regis is you never just treat the addiction, you always treat the individual, and you can come up with that individualized plan to find out exactly what that person needs.
Correct. We work with each person individually. Everyone has their own addiction, whether that be alcohol or drugs, and we work with that patient to support them through group therapies, through one-to-one counseling, through medication therapies, and emotional support.
And I love that you find out normally the root cause behind the addiction and then help them build that support system when they leave here so that they don't go back to it. A lot of people, the first step is the scariest step, and that's just to call. And when they call, you guys are friendly. You're going to help them out.
Correct. We do an admission process to where we do an intake. We talk to the patient, to the family members who call. We ask a lot of family history about their addiction process, and then we go from there.
The Mount Regis Center is located on Kimball Avenue in Salem. For more information, you can call 540-389-4761, and you can go online to mountregis.com.